Well, I became an ophthalmologist, an eye doctor, because I wanted to help people see. I started out actually wanting to go into psychiatry, which is a way of helping people see, I guess, but when I first looked through a slit lamp and saw an eye, it looked like an organic jewel, and I said, this is really what I want to do. LASIK has reached a pinnacle of safety, precision, and accuracy that was unknown 10 years ago, thanks to the advances of intralays, the blade-free type of LASIK, and custom view, which is the wavefront-driven measurement, customized mapping of the eye. This allows us to arrive at a degree of sharp vision that is oftentimes unattainable with glasses or even contact lenses.
Before I had LASIK vision correction, I started with contacts, and I hated them. They bothered me every single day. So then I tried glasses, and I just never liked the way I looked in glasses. They always bothered me. I always felt like I could see the frames, and so I just went without for years, and to the point that I was missing exit signs on the interstate. That's when I decided I really needed to do something. The procedure took literally 15 minutes, and then I was done, and then I got to lay on the sofa and take a nap, and then when I woke up, my vision was awesome. 20/20. What could be better?
I was really nervous about the procedure leading up to it, but I got here and it felt like I was walking into a room full of my aunts and uncles. Everybody was just making sure that I felt good. My prescription was low, and I think that may be a little bit rare for people, but I had perfect vision when I woke up the next day.
I had the ICL a few months ago, and what actually led me to really needing or feeling the need that I had to get this procedure done was actually because of my wedding day. When I walked down that aisle, my eyes were so itchy and blurry and red that I didn't even know if my husband was standing at the end of the aisle. That's how bad my vision was. And it was at that point when I realized I've got to do something, because I can't live life like this. I can't live through these big moments in your life and not being able to see them clearly was just unacceptable to me. My vision today is actually better than 20/20, which I don't think anyone can ask for anything more than that. I mean, I can see more than perfectly. It's one of those things where I wish I could go back now and redo big moments in my life, like my wedding day, and be able to see things crystal clear like I can today.
Cataract surgery has advanced tremendously over the past 10 and 20 years to a degree that would have been unbelievable when I started my career. I remember a time as a child seeing my grandparents and their friends wearing these very thick glasses, which I had explained to me was because they had cataract surgery. Those are completely unknown now since the advent of lens implants. The safety of the instrumentation through phacoemulsification, through microsurgery, has improved the speed, accuracy, and safety of the phaco operation, where nowadays it's an outpatient procedure that typically takes 15 minutes or less and requires minimal anesthesia.
Honestly, I didn't know I had cataracts. It was talking with some friends. We had talked about some vision issues, and he says, "You may have cataracts." And I said, I can't believe that. But went and had him tested, and sure enough. And one of the things he told me, my friend, was that when I got rid of the cataracts, how much better the colors would be. And he was absolutely right. It's been like coming to visit old friends. From the time I walked in, from the receptionist to Dr. Woodham, it's just like visiting old friends. It's one of the few doctors I don't mind coming back to visit.
I found out I had a cataract by visiting my local doctor up in Canton, and I knew I had one growing, but I thought it was growing a lot slower. And with the physical exam, I knew that I had trouble, because he said, "I can't make your lenses work any better." He said, "We better remove the cataracts." My overall experience here at Woodhams was excellent. From the time I walked in the door till I walked out the door, which seemed a very short time, everybody was very professional, very welcoming. I had no trouble. It just worked out perfect.
Prelax, or presbyopic lens exchange, is offered exclusively at the Woodhams Eye Clinic. It consists of the removal and replacement of the natural lens of the eye with any degree of cataract, with the primary goal being to correct distance vision and near vision simultaneously, all without the need for glasses postoperatively.
Hi, I'm Jan Granum, and I'm a surgery counselor at Woodhams Eye Clinic. Prelax changed my life in such a wonderful way. Before I had this surgery, I literally could not see anything past right here. Everything was shapes and colors. The night I had it, I sat on a couch about 6 or 8 feet from the TV and read the movie credits and cried like a baby. Do you know what a wonderful feeling that is? My favorite thing about being a refractive coordinator at Woodhams Eye Clinic, which I've done for many, many years now, is the ability for me to share my experience with them and explain to them exactly what Prelex can do for them and how it can change their lives in a positive way. I have tremendous respect for Dr. Woodhams. He maintained his intraocular skills along with his LASIK skills. I believe it gives him an incredible understanding of how the entire eye works together because he can treat all aspects of your vision.